Hello everyone. In today's lecture we shall consider the topic barbiturate poisoning. Okay. So certain drugs which are used for therapeutic purpose, so they may also result in poisoning. Okay. So if they are consumed in more than the prescribed amount, okay, so in very large quantities, if they are consumed by certain patient, may it be purposefully done, maybe to commit suicide in case of the mentally ill patients, or sometimes with an intention to kill someone, the more number of medication or some tablets may be mixed into some food and it may be given for consumption. Okay, so it may be a suicidal attempt or say homicidal attempt. Okay, or sometimes a layman may not be aware of the adverse drug reactions. Okay, so they may not know what are the consequences of consuming more amount of medication. So accidentally sometimes they may consume more number of dosage, which may result into the toxic effects of that particular drug, or poisoning of that particular drug may take place. Okay, so certain drugs which have narrow margin of safety specifically, so they may start precipitating poisoning even if few more doses are consumed. Okay, so let us consider the barbiturate poisoning. Now before going into the actual manifestations or the symptoms and the treatment of this poisoning, we should be focusing more on what are the manifestations and how you can treat that particular poisoning. That should be the main aim. So we have earlier covered in one of the lecture the general management of poisoning. So we have seen what are the different measures which we can take when poisoning has taken place. May it be some of the chemical which has caused toxicity, or maybe it will be a drug. So if it's a drug, you know the pharmacology. If you know the pharmacology, it will be better to understand what are the types of toxic effects which that particular drug can produce. So it will be easier for you to treat that particular condition. So our main aim, why we are studying the toxicity, is with the aim of treating that particular toxicity, right? Or how we can prevent that particular toxicity from happening. Okay, so that should be our main aim. Now before going into the actual poisoning of barbiturates, let us consider few general points about the barbiturates, like how they act or what type of deleterious effects they can have on the body. So that will make it more clearer how exactly the poisoning is taking place, what are the manifestations and how it can be treated. Okay, so to brief over barbiturates, these are basically, if you look at the chemical structure, these are the substituted derivatives of barbituric acid. Okay, so these are the derivatives. So many substitutions were done, and the drugs with ideal property, okay, having mostly the action on the CNS, such type of agents were introduced. So when these drugs were introduced, so many derivatives came into picture with different substitution of different groups on the barbituric acid. Okay. So several agents were discovered. Specifically, they were having sedative hypnotic property, that is, they could calm down the patient. Okay. Or hypnotic is a drug which can induce the sleep in particular individual. Okay, so such type of drugs were discovered and they were widely used when they were discovered. Okay, but they had so many disadvantages which have come into picture. Slowly the drugs were studied in detail, okay, and so many adverse reactions came into picture, which actually has put these drugs on a backseat. Okay, actually nobody prefers these barbiturates now. There are very few situations in which barbiturates are actually preferred. So these are the derivatives of barbituric acid. Okay, and basically these are general depressants on all the excitable sets. Okay, so they are the depressants. In whatever systems they act, they result in depression, okay, on that particular system. Now, out of all the systems in the body, the most sensitive system is the central nervous system. And out of these, certain areas in your CNS are more susceptible towards the depressant action of the barbiturates. Okay. Now, let us brief on the mechanism of action, how exactly it is acting as a depressant. Basically, this is the biomolecule on which they are acting. Okay. GABA BZD receptor chloride channel complex. Okay. It's actually a chloride channel, but this particular chloride channel, it is modulated by GABA. Okay, GABA, when it binds to this chloride channel, it opens the chloride channel, so chloride ions will flow through. Apart from the GABA binding to this receptor, there is a specific BZD receptor also, which is, that is benzodiazepine receptor, is also located on this channel. So benzodiazepine, when it binds to this channel, it can also open the channel. Okay, so specifically a chloride ion channel. So ion channel, this is actually a protein, integrated protein, okay, which will traverse through the membrane. Now, when an ion has to cross a membrane, it has a charge, so it will repel. It will not be able to cross the lipoidal membrane, right? So, for that purpose, there are specialized channels which are located in the membranes, which are made up of proteins. So, there will be several subunits which are put together like a rosette. Okay, so you all must have looked at a flower bud. So, it's just like that. 5 of them are held close together, and when that channel is stimulated, all of these will move apart, and in the middle there will be an aqueous porine channel through which these chloride ions will flow through. So that's how a charged chloride ion can cross that membrane. So basically this chloride channel, it has 5 subunits, 2 alpha, 2 beta and a gamma. So there are 5 subunits of this chloride ion channel, onto which GABA actually binds and open this channel. Okay. At the same time, your barbiturates, this can also bind to this chloride ion channel and open this chloride ion channel. Okay, now let us see how exactly it produces the opening of that chloride ion channel. Okay, basically barbiturates, when they are used in therapeutic doses, they potentiate this GABA binding to its receptor. Okay, we have seen that GABA is a modulator of this chloride ion channel. So barbiturate, it potentiates the GABAergic inhibition. Okay, actually GABA, it's an inhibitory transmitter. So when it binds to this chloride ion channel, chloride ions will flow through, potential across the membrane will change, and it will produce a depressant action. Okay, so this inhibitory action, it is potentiated by barbiturates. Now how it does? Barbiturates, it actually potentiates the action of GABA binding to its receptor. So it is acting through GABA. Okay, so as a result of this, what it can do? It can increase the lifetime of this chloride ion channel opening, which is induced by GABA. So it is having GABA facilitatory action. So it facilitates the action of GABA, okay, at therapeutic doses. But at higher doses, barbiturates can themselves also increase the chloride conductance. That is, they have GABA mimetic action. So they can produce the same action like your GABA at higher doses by themselves without the involvement of GABA. Okay, so at therapeutic doses, they have GABA facilitatory action. Higher doses produces GABA mimetic action. So basically how they act, they increase the chloride conductance and change in the potential, and that's how inhibitory action is produced. Mostly the action is mediated through GABA. Higher concentration, direct action is also possible, plus it has certain other mechanisms also. Inhibition of calcium dependent release of the neurotransmitters is also affected at higher concentration. So this is what the chloride channel looks like exactly. So it has 5 subunits, a 2 alpha, 2 beta and a gamma subunit. Okay, so this is how it is located, and in between there is a chloride ion channel. Okay, so there is an aqueous pore. So when these subunits, they move apart when the channel is stimulated, when GABA binds to its receptor, the subunits will move apart, this channel will open and chloride ions will flow through. They will be moving towards the interior of the cell, intracellular side they will move. So as a result of the movement of an ion, a negative charge is moving, so there will be change in potential and it will produce the inhibitory action. Okay. Now the barbiturates, they have a specific receptor to which when barbiturates bind, they can increase GABA binding to its receptor, and that's how it will open the channel. Whereas at higher doses, barbiturates can directly open the channel also. So this is how barbiturates act as a GABA potentiating drug, or it will be themselves suppressing the channel. Okay. Now coming to some of the actions of barbiturates. Now actually barbiturates mainly act on the CNS. Okay. But apart from this, there are several other systems which can be affected by barbiturates. Okay, so it's not a site specific drug. Actually, its main site where it is supposed to act as a sedative or hypnotic or as a general anesthetic, it's basically located in CNS. But there are many other systems which are altered by barbiturates. Okay. Now let us see some of the important actions of the barbiturates. Okay. Basically these barbiturates produce dose dependent effect on the CNS. So as you change the dose, the effects which are seen, they may also be different. So at lower doses, barbiturates produces sedation. So only it will calm down the patient. Okay. So sedative effect will be produced. The responsiveness of the patient will be decreased. If you go at still a little bit higher dose, they can induce sleep. They can act as hypnotic. If you still increase the dose further, anesthesia can be induced. That is, there will be reversible loss of consciousness as well as the loss of all the sensations in the body. So general anesthesia can be produced. Okay. And if you go still at higher doses, the person may also go into coma. Okay, so dose dependent effect can be seen on the CNS. Now coming to the respiratory system, it produces respiratory depression. Now how it is actually producing this respiratory depression is by depressing all these drives towards the respiratory center. Okay, so now your respiratory center, it's a vital center which is controlling the rate of your respiration. Now depending upon the body requirements, the rate of respiration is adjusted. Supposing if you are exercising, what happens to your rate of respiration? It automatically increases, right? That's because the respiratory center, it gets a signal to do so. So likewise, depending upon the signals, the respiratory center will be stimulated. Now say certain neurogenic stimulation may come towards the respiratory center, and that may stimulate the respiratory center. Or say hypercapnia, increase in the carbon dioxide in the body. Obviously respiration will be enhanced to remove that carbon dioxide out of the body. Or hypoxia, decrease in the oxygen level. So your respiratory rate will increase to bring in more and more oxygen. So these are the drives towards the respiratory center which can stimulate the respiratory center. So what barbiturates are doing is, all these drives which can stimulate the respiratory center, these are depressed in succession. So it's the neurogenic drive which is affected first, then comes the hypercapnic drive and hypoxic drive. So it can be quite dangerous because barbiturates in the poisoning, it can depress the respiratory center, and that's how respiratory depression can be produced in the toxic levels. Apart from this, the CVS is also affected. The toxic doses, it produces more marked fall in BP. That's because the ganglionic blockage may take place, or vasomotor center which is controlling the BP, that is also depressed. Even barbiturates can directly decrease the cardiac contractility. So all these reasons are responsible for producing marked fall in BP. Okay, so it will be severely affected. Apart from these anesthetic doses, a little bit higher doses, it can reduce the muscle contraction. because the excitability at the NMJ is affected. Okay. Apart from this, the urinary system is also affected. Barbiturates reduce the urine output by decreasing the BP. We have seen that it produces fall in BP. So urine output, obviously it depends upon the blood pressure. So more the blood pressure, more will be the filtration rate, right? It will take place at a faster rate. Okay, so if BP decreases, obviously the urine formation also, the speed will decrease. Also barbiturates can increase the ADH release, antidiuretic hormone, okay, which is responsible for decrease in the urine output. This particular hormone of the pituitary gland, posterior pituitary gland, it is responsible for decrease in the urine output, which is increased. The level of this hormone is increased. So obviously it will further reduce the urine output. So these are some of the deleterious effects which can be produced by barbiturates on the other systems of the body. Now the major disadvantage of these barbiturates is the narrow safety margin. Okay, and we have seen, as we have seen earlier, that it can affect most of the other systems of the body, and it is having adverse effects on those systems, right? Okay, so these are the major disadvantages with the use of barbiturates. So these drugs are seldom used now. There are very limited use of these barbiturates. Phenobarbital, it is used in epilepsy, of course it is used in emergency situations also, like status epilepticus. Then thiopentone sodium, it is used as an anesthetic. Okay. So apart from these are hardly used as adjuvants in psychosomatic disorders. So with the discovery of this particular drug, with the introduction of benzodiazepine class of drug, the barbiturates have gone out of use. Almost they have gone out of use. There are very few situations in which barbiturates are being used. Okay. So because of their narrow safety margin, and their narrow safety margin in the sense little increase in the dose may start precipitating the toxic effects. Okay, so also they can have deleterious effects on the other systems. Okay, so these are the situations because of which the poisoning may take place. So either there may be a suicidal attempt to consume more now, because these were used as sedative hypnotics, right, to induce the sleep. So usually what people do to commit suicide, they consume the sleeping tablets, right? Okay, so mostly the attempt is suicidal, or sometimes accidental extra consumption of the doses may also be responsible for the poisoning. Okay, so the principles of treatment for this poisoning, these are same as those which are applied for the CNS depressant poison. Okay. So here the lethal dose, again it depends upon the lipid solubility, which can result in death. So it may be 2 to 3 grams for the more lipid soluble agents. So it is less. Okay. So those which are short acting barbiturates, and in case of less lipid soluble agents, a little bit higher dose may be responsible for the death of the patient. That is 5 to 10 grams may be the lethal dose which is calculated. Say for example for phenobarbital. Okay. Now coming to the manifestations, okay, or what are those symptoms which will be presented to you. Okay. Usually these manifestations will be an exaggerated form of the pharmacological actions. Okay, so just now we have seen what are the few of the important pharmacological actions. Okay, so these will be just the extension of those pharmacological actions. Say the patient will be flabby and comatose, because we have seen that CNS depression is produced. Okay, with shallow and failing respiration. So respiration will be depressed at the higher doses. Okay, reasons we have already seen. Also, next type of manifestation will be fall in BP, or cardiovascular collapse may also take place, okay, because of the action on the CVS. Renal shutdown, that is oliguria, may attend the barbiturate poisoning. Oliguria is decrease in the urine output, okay, because we have seen that urine output is reduced by barbiturates. Then pulmonary complications also may be precipitated because respiration is affected. Then specific type of reaction may occur, like bullous eruptions may be seen, blistering may be seen on the skin. Okay, so these are some of the manifestations which will be presented to you in the form of barbiturate poisoning. Now let us see how it can be treated. So first and the foremost measure we have seen under the general treatment also is to reduce the exposure. Okay, so first measure which you can take, if the patient comes to you within 2 hours, you can go for gastric lavage. Stomach wash can be done to remove whatever drug is present in the stomach. So to prevent the further exposure, decontamination can be done with the help of gastric lavage. So here you can use a suspension of activated charcoal. Okay, so it is left in the stomach, okay, and it is removed out with this process of gastric lavage. Okay, so whatever drug is present in the stomach, it will be adsorbed on the surface of this activated charcoal. So further it will prevent the further absorption of the drug from the intestines. Okay, so it will be prevented from the absorption. Further exposure towards that patient will be prevented. Okay, provided the patient comes to you within 2 hours of consumption. Otherwise it will not be of any help. Once it goes into the intestines, you cannot perform this gastric lavage. Okay. Then next very important measure is supportive measures. Say for example patent airways, maintenance of patent airways. Okay, so you need to prevent your airways from collapsing. You need to keep them open. Okay, assisted respiration may be given because respiratory depression is produced, right? So as a result of this, the hypoxia may be seen or precipitated in the person. So you may have to administer oxygen. Then next important measure is maintenance of the blood volume. Maybe fluid infusion may be required, or you may have to give vasopressors to maintain the blood pressure. Dopamine may be preferred in this particular situation. Okay. Now the next measure is the alkaline diuresis. Now for this purpose, sodium bicarbonate in the dose of 1 milliequivalent per kg IV along with maybe mannitol may also be introduced along with sodium bicarbonate. Now this particular treatment is given to alkalinize the urine. Okay, alkaline diuresis meaning production of alkaline urine. Usually the pH of urine is acidic in nature. Okay, now you can change the pH of your urine by introducing the alkali into the body. Now what is the purpose of alkalinizing the urine? Now we have seen that in case of the drugs, the ionization state is dependent upon the pH, right? pH of the medium in which it is present. Okay, so basically we have seen that acidic type of drug, they remain more in unionized form in the acidic pH, and the basic type of drugs, these are more in the unionized form in the basic pH or the alkaline pH. And we have also seen that the ability of your drug to cross a membrane, a biological membrane, it depends on the ionization state. So if your drug is in the unionized state, it can cross the membrane very easily. Okay, now what will happen by alkalinizing the urine? Now since these barbiturates, these are acidic in nature, so in case of acidic urine, your barbiturates will be more in the unionized form and they will get reabsorbed by the process of tubular reabsorption. So anything which is filtered at glomerulus, we have seen that 99% gets reabsorbed, right? So same will be applicable to the drugs if they are in the unionized form. Okay, so now in this particular situation, barbiturate poisoning, if you alkalinize the urine, what will happen? Barbiturates are acidic in nature. So when they encounter alkaline urine, they will be more in the ionized state. So what will happen? Their reabsorption will be prevented and more barbiturates will get eliminated by renal excretion. So you are promoting the excretions. You have to remove your drug which has caused poisoning out of the body. So this is one of the way by which you can remove it out if it is already absorbed into systemic circulation. Okay, so this is a very important measure which can promote the excretion. It will remove your drug out of the body at a faster rate. Apart from this, some other measures can also be followed, okay, specifically in case of long acting agents, okay, or certain short acting barbiturates also. So basically hemodialysis and hemoperfusion may be utilized in such situations, okay. Now hemodialysis, okay, usually kidneys, if they fail, dialysis is done, right, to remove the toxic substances, right, from the body. So here in this particular case also hemodialysis is done to remove your drug out of the systemic circulation. Either hemodialysis or hemoperfusion can be preferably done, okay. So your blood is passed through a column of activated charcoal or the other adsorbents, okay, so that the drug which is present in your blood, it can be adsorbed and then it is returned back to your circulation, okay. So such type of procedures may also preferably use for longer acting agents, okay. So these are some of the important treatment lines for the barbiturate poisoning. Now the major disadvantage with barbiturate poisoning is no specific antidote which is available for barbiturates, which can reverse all the actions of barbiturates, okay. So once it is in the body, it will start acting on several systems, okay. So there is no drug which can be administered which can antagonize all the action. It is not available. So that's why barbiturate poisoning is quite dangerous. In the older days, analeptics were used, respiratory stimulant drugs were used, metrazole or bemegride, such type of drugs were used, okay, to awaken the patient, because we have seen the patient become comatose, CNS depression is produced. So an attempt was made to give the CNS stimulant drugs or respiratory stimulant drugs. However, this particular measure is quite dangerous because it can precipitate convulsions. You are not supposed to administer CNS stimulant drugs in a comatose patient, otherwise convulsions will start precipitating, okay. So this can increase the chances of mortality. So that's why it is better not to give any kind of medication in the barbiturate poisoning. Only supportive measures can be taken, what we have discussed so far, or an attempt may be made to excrete the drug out of the body or remove it by hemodialysis or hemoperfusion. So it's better to take certain measures to increase the survival rate of the patient, okay, till the poison is eliminated. So it will be quite dangerous, especially in those cases of barbiturates which are longer acting, okay. So this is to do with the barbiturate poisoning. This is the reference. Thank you.